It's important when you process PRP that you know what sort of cellular components you want for the treatment. In my practice, I want a high-yield platelet-rich plasma, which means 4 to 6 times baseline concentration of platelets. I want very low inflammatory white blood cells, so low granulocytes. I want very high monocytes, which are an anti-inflammatory white blood cell, and I want a high concentration of biologic proteins. So I use the Emcyte system. Emcyte is a great company. They've been in the regenerative cellular medicine business for 17 years, so they're not a newcomer by any means. The Emcyte system lends itself to lots of flexibility. There's several different PRP medical devices which will allow you to spin whatever type of platelet-rich plasma it is you're looking for your treatments. There is also bone marrow stem cell medical devices as well as fat grafting medical devices. So it's a great system that will grow with your regenerative therapy practice. In this particular case, we're going to use the pure PRP2 system. Everything that you need to process 10 milliliters of platelet-rich plasma is actually in the kit. There are 2 60 cc syringes. You can see I've already drawn my patient's blood. 30 cc syringe, a 12 cc, a 3 cc, the blood drawing kit complete with the butterfly, the anticoagulant, and in this case we use sodium citrate, and then 2 sterile concentrating cylinders. So the first thing that we do is follow this protocol. This is the pure spin protocol. It comes with your centrifuge, and in fact there's one in every case of the pure PRP2 kits. So the first thing that we do is we add anticoagulant to our 60 cc syringe. We add 10 cc's of the sodium citrate. We then put our butterfly on the 60 cc syringe and draw whole blood. So this is anticoagulated whole blood. You can see these 2 cylinders are a bit different. The separation cylinder has a disc in the middle, and the concentrating cylinder does not. So the first thing we want to do is spin in the separation cylinder. We take this red cap and we throw it away. That's simply an extra level of sterility. This is a self-sealing closed system. It's a luer lock to luer lock. I then push the anticoagulated whole blood into the first cylinder. You can see there's a bit of an air gap, and that's because there was air underneath the disc. So at any time throughout this first process, I pull back on my syringe to draw the air out, and you can now see it's in the top of my 60 cc syringe. There's no air underneath that disc. That's an important feature because it allows me to get all of this anticoagulated blood into this disc. If I did not remove the air, then I would likely have some blood left in my syringe. So that's our first step. The next step, we have an optional, you can see it on the cheat sheet here, we have an optional step that eliminates any additional red blood cells. And that is what I'm looking for. I don't want any red blood cells in my PRP sample. And so I'm going to draw about 1 cc of the anticoagulant. And I'm going to flush this tube here just by simply pushing that in. So you can see there's no red blood cells in my tube. I'm ready to spin and separate. The scale comes with the centrifuge. I want to be within a couple of grams. So 112.5, 112.6. That worked out perfectly. I'm going to place both of my cylinders. This is a magnetic lock top, so I just hold it down for a moment and it catches. My first spin is at 1.5 minutes at 3,800 RPMs. I can adjust my speed with this. I can adjust my time with this knob, and then as soon as I press the left knob, my spin starts. You can tell that because I have these 2 horizontal lines. Now you can't hear the centrifuge That's intentional. There's a very soft start and a very soft stop. The time will not start until the centrifuge gets to speed, which again is at 3,800 RPMs. I'm going to review with you while that's spinning. We draw 10 cc's of the sodium citrate into our 60 cc syringe. We then draw a patient's blood, so we have a total of 60 cc's of anticoagulated blood. We load our first separation cylinder with a little disc in the middle. And if you like to decrease your number of red blood cells like I do, you'll flush the tube with a little bit of anticoagulant. This says 1.5, anywhere from 1 to 1.5. You then spin for a minute and a half, which is what we're doing. Now, at the end of the spin, we're going to see that we have red blood cells at the bottom and then a platelet suspension at the top. We've not actually created a buffy coat, and that's intentional. What we want to do with this system is we want to go through a process of eliminating whatever cellular components we don't want. So this first spin is driving the granulocytes and the red blood cells to the bottom of the cylinder, allowing the platelets and monocytes and proteins to be suspended above. We will then take that out and place it in our separation, or rather concentration cylinder. We'll spin it again for 5 minutes, and that will create a layer at the bottom that contains our platelets and monocytes. We'll take off whatever platelet poor plasma we don't want. We'll leave in the cylinder 7 to 10 cc's of platelet poor plasma. We will then swirl to resuspend all of the platelets. So we're taking 60 cc's of an anticoagulated blood, eliminating red blood cells and granulocytes, then placing the platelets suspended in the plasma, further concentrating that by eliminating platelet poor plasma, and then resuspending all of those platelets that were in the original 60 cc sample into 7 to 10 cc. So you can see we have a reliable 4 to 6 times baseline concentration of platelets in our plasma sample. The reason that's important is in order to get the full regenerative benefit of platelet-rich plasma, you want the appropriate concentration for maximum stem cell migration to the area. There's actually very clear data that shows that a 6 to really 10 times concentration will facilitate mesenchymal stem cell migration to the actual treatment area. So you're getting the benefit of stem cells. You also must have a 6 times concentration for angiogenesis to occur. Actually, it's a neuroangiogenesis that occurs. So we're re-stimulating nervous tissue as well as creating new blood flow, new blood vessels. So that's very, very important to understand about platelet-rich plasma. There are a lot of systems out there, many of which don't actually produce a 4 to 6 times concentrated plasma. Many of them are 10 cc draw, creating 5 cc's of what's being called platelet-rich plasma. Well, you can imagine if you draw 10 and every one of those platelets then finds its way to 5 of the PRP, it can never be more than 2 times concentration. So you have to understand a little bit about what it is that your goals are. And in our case, we want maximum effectiveness and best patient outcome. So we really want to clearly meet the definition of platelet-rich plasma. We also understand that we want very low inflammatory response. So when we're placing our PRP in the scalp, for instance, for the studio scalp, we don't want inflammation to occur. We want a very, very rich PRP without inflammation. So the first spin is over, and the top pops up automatically. And you see that this is our first separation, where your red blood cells and your granulocytes are at the bottom. All of the platelets, biologic proteins, and monocytes are at the top. We've not created a buffy coat. I'm going to take the second 60 cc syringe, and I'm going to screw it onto the top, and then just pull out the platelets in the plasma suspension. And I can stop just when I start to see that little red flash. So I actually have all of the platelet suspended in plasma without any of the red cells and the granulocytes. Now, if I would have dropped this before I was successfully pulling out my plasma, I can just invert a few times and respin. Okay, so it's a very flexible, easy to use system. I'll discard, and now I will put all of this platelet suspension, or plasma rather, into the second cylinder to concentrate it further. Now, I had 60 cc's of anticoagulated blood to start. I've created 30 cc's of a platelet suspension, so I have 30 cc's of a 2 times baseline concentration. So this is equal to 6 or 7 of the 10 cc test tubes. But that's not good enough for what we're trying to do. We want to create an angiogenesis. We want to stimulate stem cells to the area. So we really are going for the appropriate concentration. So now I weigh again for our centrifuge, 65.3. I want to be within 1 to 2 grams, 66.9. That actually does it, although I'm going to pull a little bit out. There you go. Again, when I close the lid, I just hold it for a moment and the magnetic catches. I turn my dial to 5 minutes at 3.8 or 3,800 RPMs. I press start. I know that it has started because I see my 2 horizontal lines, and the timer won't start until my centrifuge gets up to speed. I don't want red blood cells in my sample because red blood cells are very viscous and can cause some irritation. If you get a few red blood cells in, it's not something I would worry about. You'll get very, very good at processing this PRP with minimal to no red blood cells in your sample. Without red blood cells, I'm able to push the platelet-rich plasma through a thinner needle, which is more comfortable. And again, I am able to dial in whatever type of PRP I want for my procedure. I can spin this kit in many different ways, but I'm showing you the pure 2 protocol with very low red blood cells. So now we have our final spin. You can see that we've created a layer at the bottom. There's a very small percentage of red blood cells. You can see at the bottom all the platelets and monocytes are there as well. And the plasma that we have here is actually platelet poor plasma. So again, we took off the red blood cells and granulocytes. Now we're taking off the platelet poor plasma. So we're slowly eliminating cellular components till we get down to exactly what it is that we want. So I take my 30 cc syringe and I draw out platelet poor plasma. There's some indicators here on the side of the cylinder. So I know that in this particular case, I want 7 cc's of platelet-rich plasma. So I'm going to leave 7 cc's in the cylinder. And now I'm going to resuspend by simply swirling. I don't want to shake. I don't want to be very aggressive. You can see that the resuspension is happening. And I just keep swirling in different directions until I have all of the platelets off the bottom of the cylinder. Now, the Emcyte system is a validated system, which means that there's been third-party validation. That data is available for you. We know the concentration of the platelets. It's a very, very consistent process. We know that they are not activated yet, that we have a very, very high concentration of growth factors and monocytes in this particular sample. So it's important to me that I understand what cellular milieu I'm actually injecting and using to regenerate. Okay, so all of the platelets, monocytes are resuspended in the plasma. That is platelet-rich plasma, and now I'm drawing it into my centrifuge, just like into my syringe, rather, just like that. And I am left with 7 cc's of platelet-rich plasma. The platelet-poor plasma I don't typically use. If I'm doing a studio scalp, for instance, I will quite frequently put the cap on the platelet-poor plasma, give it to the patient. For the most part, I don't use the platelet-poor plasma, although there are biologically active proteins in there. I'm going to discard this and use the platelet-rich plasma for my procedure. So that's a quick run through the pure PRP2 protocol. And I did the optional step of eliminating as many red blood cells as possible. And if you just follow step by step, you will create a very consistent platelet-rich plasma every time.